Hey there, today we're diving into the fascinating world of brain health, particularly focusing on chronic traumatic encephalopathy, or CTE for short. That condition that sometimes shows up after repetitive head impacts. Think of boxers, football players, rugby enthusiasts, even folks involved in certain military blast injuries. Repetitive brain trauma, whether from concussions or even subconcussive hits that don't cause obvious symptoms, can lead to a progressive neurological deterioration. Over time, this can manifest as neurobehavioral changes, mood swings, depression, anxiety, or even impulsive and violent outbursts. What's really happening inside the brain? Well, one key player is tau protein. Under normal circumstances, tau helps stabilize microtubules in neurons, but with repeated trauma, tau can become hyperphosphorylated. A fancy way of saying it gets overly modified by adding phosphate groups. This leads to tau mislocalization and aggregation, forming neurofibrillary tangles and neurofibrillary. These are like the tangled up spaghetti of the brain, especially striking in cortical, sulci, and sulcoblasts, often in the frontal, temporal, and parietal cortices, as well as structures like the hippocampus, amygdala, and in the brainstem. In CTE, we often see a distinctive pattern p-tau pathology, perivascular accumulations around blood vessels, especially in the so-called death. These tauopathies are sometimes accompanied by beta amyloid plaques, similar to what we see in Alzheimer's disease, but with their own unique features. For example, perivascular p-tau deposits, astrocyte tangles, and clustering tau fibrils are hallmark signs during postmortem examinations. It's not just about tau. Other features include cerebral atrophy, thinning of the corpus callosum, cavum septum pellucidum, and scarring in areas like the cerebral tonsils. Some folks also show signs of neurodegeneration in the substantia nigra, leading to Parkinson's symptoms, or in other subcortical regions. CTE isn't just about the damage, it's a complex, multifaceted disease influenced by age, gender, genetics, like APOE, alleles, stress levels, substance abuse, and the number and severity of impacts. The more hits, the higher the risk of developing the condition. CTE can present with a range of symptoms: cognitive decline, executive dysfunction, mood disturbances like depression, anxiety, and motor issues such as tremor, slowness of movement, extrapyramidal symptoms. Sometimes individuals experience visual or hearing disturbances, weaknesses, or even seizures. Beyond diagnosis, understanding the mechanisms involves looking at kinase activity enzymes like c-Jun and terminal kinase that phosphorylate tau, and how this leads to tau aggregation, microtubule disruption, and neuronal death. Remember, our brains are resilient but also delicate, and understanding these processes help us appreciate the complexity and need for ongoing research. Stay curious and take care of that nappy.